I wonder what you think can be done to put us on the right track here.
Well, actually, we faced two problems. The first one was, is there a sort of unfair treatment, unfair distribution between the UK and the EU from AstraZeneca, saying that, okay, we are going to ship and deliver all the vaccines to the UK, but we are going to restrain the doses delivered to the EU only. So that's the first thing, and that's why it was so sensitive within the EU, because we had the feeling that there was a sort of double standard. And then that's why it was in detail discussed with the UK, and we managed to have a compromise. Then there is a second problem. And the second problem is different. The second problem is, are we facing a lack of capacity to produce whatever the final destination is there a problem of production capacity in the EU market from the AstraZeneca plants? And then that's why we need to work with them to increase the capacity production, because of course we need to deliver more and at speed.
I want to bring in Maria Tadeo to this conversation. She covers everything Europe for us from Brussels. And Maria, why don't you give us also your take, and feel free to ask Pascal anything about what the mood is in Brussels right now.
Yes, and look, Matt, as you were mentioning, this is 40 million vaccines that AstraZeneca is now promising to put on the table, but it's worth highlighting here that this is still a big cut. This is almost 50% lower from the original target that the European Union was hoping, 80 million vaccines in Q1. And Pascal, that's almost my question to you. When you look at 40 million vaccines, would you say that's good enough for Europe, or this was just the only take that you could get to avoid a bigger confrontation from going even more public?
Well, there are, again, two things. The first thing is that we have ordered more doses to Pfizer. Okay? So if ever we are short of AstraZeneca doses, maybe we can compensate with more Pfizer doses, and that's a question of timing. The problem is that I can't answer exactly this question because the timing delivery, I would say month per month, is not public. So I don't know if buying more Pfizer doses will compensate less Astra doses. Then there is a second question regarding AstraZeneca, which is, are they facing a lack of capacity problem, and how can we help for them to produce more in line with their commitments in the contracts? So there are two issues still on the table to be solved and to be clarified. But of course, what happened this weekend and the decision to have more doses to be delivered to the EU is a good first step in the right direction.
Okay, when you say this is going to be a step in the right direction, is that because you believe AstraZeneca will step up in time? And again, you know, for many Europeans, there has been a lot of whiplash. You know, a week ago, this was a bad deal. Everyone was angry at AstraZeneca. And then on Monday morning, it's almost a good compromise. You know, why is there this whiplash in the same week?
No, you know, actually the story dates back to a couple of weeks when we all knew the AstraZeneca vaccine would be authorized. And there were conversations between the European Commission and AstraZeneca. And the European Commission asked AstraZeneca to start storing the vaccines in order to deliver and to send the vaccines doses as soon as possible once the vaccines will be authorized. And AstraZeneca, to my information, said, well, no, we are not going to store your vaccine. We are going to ship the vaccines we have, and we are going to start storing once the vaccines will be authorized in the EU. So it means that there will be a 2 weeks, 3 weeks, 4 weeks delay. And that was the starting point of the problems we faced with AstraZeneca, and the feeling we had as Europeans that they didn't treat us fairly, compared to others like the UK, for instance. That's the starting point of the problem we faced with them.
Right, and that's also key here, because what is clear to me whenever I speak to any European official here in Brussels, but also in the big European capitals, is that the EU does feel that it was a damage party in this whole negotiation, and that if anyone has been treated unfairly is the European Union. So then I wonder, when you see the whiplash from everyone else accusing the EU of being nationalistic on the vaccines, would you say that's a failure in your communications?
The fact that it's a very good thing, and we have been supportive of that from the very beginning, that we have a single European framework. I mean, like in the US, there is a single US framework. There is no Texan contract and a Californian contract and a Washington, D.C. contract. Okay, so that's exactly the same in the EU. We are better off. We are better off with one single negotiating framework instead of having 27 contracts competing with each other. And the fact that the only one we are more or less competing with in terms of delivery is the UK, because of the Brexit. And there was a clash, okay, 27 countries on one side, one country on the other, and there was one clash. Imagine if we would have had 27 contracts, then there would be clash every day between France and Spain, Germany and Poland, Italy and so on, because we would compete each other to access this vaccine. So it's good that we have a single European framework. And then, of course, we have to demonstrate that we make the most to deliver at speed. And that's why we face these problems, specific problems with AstraZeneca. I don't see it as a problem or a failure. The word was used. It's not a failure of the European process. On the contrary, what would you say today if the Commission would have said nothing to AstraZeneca, knowing that there was a sort of unfair treatment between the UK and the EU? The Commission was completely in its role to do what it did.
Sense has to wonder why it took Europe so long. I mean, Brexit's not the only difference between the EU and the UK. You weren't just a week late asking AstraZeneca, or 2 weeks or 3 weeks, but 3 months later. I mean, why did it take so long to do what you should have done so long before, when everyone knew this was coming? That looks like a failure of the European process.
So, you know, regarding the emergency authorization used by the UK government, I mean, it was under the framework of the European law. All the European countries could have done that if they had wished to, but none of them did. Why? I mean, that's a good question.
They should have all done it on time.
Why? Because
they should have all done it on time rather than waiting so long and causing these problems.
They could have. They could have.
Why didn't they?
No. Why? For two reasons. The first reason, exactly, so let me answer you. The first answer is because we wanted to follow and to wait for the formal authorization from the European medicine agencies. Because we have rules in place and we wanted to have a safe authorization from the EMA. And because we do not want neither to have full liability for the government and zero liability for the pharmaceutical companies. And second, you know, in the UK vaccine strategy, they are fully on the first dose. They use the first dose of Pfizer and AstraZeneca. And they do not, and then they change the protocol. Against the will of Pfizer, they changed the protocol to wait for the second doses after 12 weeks, I think, which is not what we decided neither, because we decided to comply and to stick to the initial protocol established by the pharmaceutical companies themselves. So it means there are two differences there that explains very easily the fact that we are behind the UK, because we made, not because we failed, but just because we made other two decisions on purpose, fully aware of the consequences, but we did differently in the EU. That's it.